Ever wondered how your blood sugar levels can impact your bone health? Welcome to the Victory Education Lounge. I'm your host, and together we're going to navigate the intricate maze of metabolic health. Today, we're focusing on a topic that affects millions worldwide: bone health, osteoporosis, and insulin resistance. This is part 103 of our ongoing series, and we're thrilled to have you on this journey with us. Your engagement is invaluable. So, if you find this video helpful, don't hesitate to give it a thumbs up, hit the subscribe button, and share your thoughts or experiences in the comments section. The connection between bone health, osteoporosis, and insulin resistance is significant, yet often overlooked. Regardless of whether you're looking to boost your bone density, manage insulin resistance, or just optimize your overall health, understanding this link is critical. Today we're going to shed light on this crucial connection between osteoporosis and insulin resistance. To understand the link, we first need to unpack what osteoporosis and insulin resistance are. Osteoporosis is a condition characterized by weakened bones that become more susceptible to fractures. It's often referred to as the silent disease because it progresses without symptoms until a bone breaks. Causes range from a lack of calcium and vitamin D to certain medications and lifestyle habits. The International Osteoporosis Foundation estimates that worldwide, 1 in 3 women and 1 in 5 men over the age of 50 will experience osteoporotic fractures. On the other hand, insulin resistance is a condition in which the body's cells become less responsive to insulin, a hormone that regulates blood sugar. This resistance results in elevated blood sugar levels, leading to prediabetes or type 2 diabetes if not managed. The Centers for Disease Control and Prevention reports that more than 1 in 3 American adults have prediabetes, and 90% don't know they have it. These two conditions may seem unrelated, but they share common causes and risk factors including aging, physical inactivity, poor nutrition, and hormonal imbalances. Furthermore, emerging research suggests that insulin resistance can directly affect bone health, leading to an increased risk of osteoporosis. For instance, insulin has an anabolic effect on bones, meaning it helps build them up. When the body becomes resistant to insulin, this building effect is reduced, leading to weaker bones. Moreover, high blood sugar levels associated with insulin resistance can lead to increased bone loss, further contributing to osteoporosis. It's also worth noting that both conditions are significantly influenced by lifestyle factors. Regular exercise, a balanced diet, and maintaining a healthy weight can help manage insulin resistance and protect bone health, reducing the risk of both conditions. Now that we have a basic understanding of these conditions, let's delve into how they are interconnected. Insulin resistance can have a significant impact on bone mineral density. This is a statement you might not have expected, but let's unpack it. Bone mineral density is a measure of the amount of minerals, like calcium, in your bones. A higher density means stronger bones, while lower density can lead to conditions like osteoporosis. Now, how does insulin resistance fit into this picture? Insulin is a hormone that helps your body use glucose for energy. When your body becomes resistant to insulin's effects, it struggles to use glucose effectively, leading to higher blood sugar levels. But insulin doesn't just regulate blood sugar, it also plays a role in bone remodeling, a process where old bone is replaced with new, stronger bone. If insulin can't do its job effectively due to resistance, this remodeling process can be disrupted. The result? A potential decrease in bone mineral density and an increased risk of osteoporosis. It's like trying to build a house with a faulty blueprint. The end result might not be as sturdy as you'd like. So, how can we manage this? First off, weight-bearing exercises can be a game changer. These are exercises where you're working against gravity, like walking, running, or weightlifting. They can help to stimulate bone formation and improve bone density. Next, we have nutrition. Ensuring you're getting enough calcium and vitamin D is vital for bone health. You might want to think of calcium and vitamin D as the building blocks for your bones. Without them, it's hard to build strong, dense bones. Lastly, working on improving insulin sensitivity can also help. This can be done through dietary changes like reducing sugar and processed food intake, as well as regular exercise. By improving how your body responds to insulin, you can help ensure that the bone remodeling process works smoothly. While managing this can require lifestyle changes, the benefits to bone health are substantial. It's like investing in a sturdy foundation for a house. It requires effort, but the resulting structure is worth it. After all, who doesn't want a body that's built to last? Insulin resistance doesn't just affect bone density. it also disrupts bone turnover and promotes inflammation. Let's delve into these two aspects now. Firstly, bone turnover. This is the process where old bone is broken down or resorbed and new bone is formed. It's a delicate balance necessary for maintaining healthy bones. Insulin resistance can tip this balance, leading to more bone being resorbed than formed. This imbalance can weaken your bones over time, increasing the risk of osteoporosis. So how do we manage this? Regular physical activity is key. Exercise, particularly weight-bearing and resistance exercises, stimulate bone formation, helping to maintain that crucial balance. Balanced nutrition with adequate protein is also essential, as protein provides the building blocks for new bone. And of course, controlling blood sugar levels is critical to manage insulin resistance and its impact on bone health. The second aspect is inflammation. Insulin resistance is known to promote chronic low-grade inflammation, which can negatively impact bone health. Inflammation can stimulate bone resorption and inhibit bone formation, again disrupting bone turnover. Addressing inflammation involves adopting an anti-inflammatory diet filled with fruits, vegetables, lean proteins, and healthy fats. Stress reduction techniques such as meditation, yoga, and deep breathing exercises can also help, as chronic stress is known to promote inflammation. And yes, you guessed it, regular exercise is once again part of the solution. Exercise has been shown to reduce inflammation, further supporting bone health. In a nutshell, the management of both bone turnover disruption and inflammation caused by insulin resistance involves a comprehensive lifestyle approach. Regular physical activity, balanced nutrition, blood sugar control, an anti-inflammatory diet, and stress reduction techniques all play a part. These lifestyle modifications not only improve bone health but also contribute to overall health and disease prevention. So, while managing insulin resistance and its impact on bone health may seem daunting, the silver lining is that the steps you take towards this specific goal can have wide-ranging benefits for your overall well-being. Insulin resistance can also impact calcium absorption and disrupt crucial hormones for bone health. But how does this happen? And what can we do about it? Well, insulin resistance can affect the way your body absorbs and uses calcium, an essential mineral for bone health. When insulin resistance is at play, your body may not be able to effectively absorb calcium from your diet or supplements. This can leave your bones starved of the calcium they need to stay strong and healthy, increasing the risk of osteoporosis. Now let's talk about hormones. Insulin resistance can also disrupt the balance of other hormones crucial for bone health, such as estrogen and testosterone. These hormones play a key role in maintaining bone density, and their imbalance can contribute to bone loss. So how can we manage these issues? One way is to optimize your vitamin D levels. Vitamin D helps your body absorb calcium, so ensuring you're getting enough of this vitamin can support your calcium absorption. This can be achieved through a combination of sunlight exposure, diet, and if needed, supplements. Ensuring adequate calcium intake is also crucial. This can be through calcium-rich foods or supplements, depending on your individual needs and dietary preferences. Addressing the underlying insulin resistance is another key strategy. This can involve lifestyle changes such as a balanced diet and regular exercise, and in some cases, medication. For hormonal imbalances, monitoring hormone levels can provide useful insights. Depending on the situation, lifestyle interventions to improve insulin sensitivity could be beneficial. In some cases, hormone replacement therapy under medical supervision may be considered. In conclusion, insulin resistance can have wide-ranging effects on your bone health, including calcium absorption and hormonal balance. But the good news is there are strategies you can implement to manage these issues. Optimizing vitamin D levels, ensuring adequate calcium intake, addressing underlying insulin resistance, and monitoring hormone levels can all play a part in supporting your bone health. Addressing these aspects can support bone health, overall calcium metabolism, and hormonal balance. Understanding the link between osteoporosis and insulin resistance is the first step towards better bone health. We've explored how insulin resistance can affect your bone mineral density, disrupt bone turnover, promote inflammation, affect calcium absorption, and even disrupt crucial hormones. The good news is there are proactive steps you can take to manage both your bone health and insulin resistance. Consider weight-bearing exercises, a diet rich in calcium and vitamin D, and strategies to improve your insulin sensitivity. Regular physical activity and balanced nutrition can support healthy bone turnover. An anti-inflammatory diet, stress reduction techniques, and regular exercise can help combat inflammation. Optimizing your vitamin D levels and ensuring adequate calcium intake can support calcium absorption. Monitoring your hormone levels and perhaps considering hormone replacement therapy under medical supervision can address hormonal imbalances. Remember, your health is in your hands. Remember, managing bone health in the context of insulin resistance requires a comprehensive approach. By addressing your metabolic health, you're not just protecting your bones, you're supporting your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to bone health and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional. Let's keep the conversation going. Share your thoughts or questions in the comments below. See you in the next video.